Hey, I'm Dr. John Minichetti. I'm one of the co-chairmen of the American Academy of Implant Dentistry's 2025 annual meeting. It's going to be in Phoenix, Arizona. And it's going to be on November 12th to 15th, 2025. We are so excited to have a star-studded lineup of main podium speakers, workshop speakers. And I have one of them with me today, Dr. Dan Holtzclaw. Dr. Dan Holtzclaw, how you doing?
Hey John, how you doing?
Fantastic. I know you're in the middle of training, and thank you for taking time from your busy schedule to talk to the AID. So, listen, we have you down for a couple of presentations. A presentation on the main podium, which is our featured speakers and topics, and also a workshop. So, what is the title of your main podium presentation this year?
The main podium presentation is remote anchorage complications. So we'll be talking about complications with zygomatic implants and pterygoid implants and transnasal implants, anything for some of these treatment of the atrophic maxillas.
Well, I know that you are an expert in this field, and now you've been involved with it, I'm sure, for a decade or more. And being one of the leaders in the world, we are honored to have you present complications, as I'm sure they're occurring, as complications occur with any implant procedure, as we all well know. On your workshop end, what kind of workshop are you presenting this year?
Well, the workshop is going to be hands-on with models, and it is a continuation of the what we're talking about on the main podium lecture. It's going to be a lecture on a zygomatic implant technique I've been having to utilize more and more on these complication cases. Something I call a Hessian zygo, and essentially, it's a different technique that crosses the infratemporal fossa and allows us to rescue some of these cases that have failing zygomatic implants or cases where there's just not a whole lot of bone remaining because there's been failures from, say, previous attempts at zygomatic implants. So we'll go through, how to place a standard zygomatic implant and then how to place these a little bit more technical remote or rescue salvage style zygomatic implants.
Very good. Well, listen, with all your experience in the zygo and pterygoid field and extraoral implant fields, what are you seeing as some of the potential problems, and why should an attendee attend your program?
Well, the thing with these procedures is, bigger procedures, bigger complications. And, some of these procedures, do have pretty nasty complications. And, the level of training for these types of procedures it's changed significantly over the years. In the past, there were very, very few people doing this. And now there's more and more people doing this. And the type of training, it varies, all across the world. So, you may go to one course, or one type of training and, get a different level of training than, say, a different course. And, what we're seeing on many of these courses or many of these cases that have complications is, it's usually just the technique or just missing some steps, and you miss some of these important steps. And, it could vary from, having a fistula that drains through the skin to, having a drill in the orbit to, blindness or severe bleeds or, other types of complications. So we'll go through, ideally how to avoid most of these complications. And then, sometimes everything's done right and there's still problems and, these patients have to be fixed. And we'll go through some techniques on how to fix these patients that have, some of these problems.
Super. Okay. So, another thing I want to mention is that we are in Phoenix. How, on a social note, what do you think about Phoenix being a location for our annual meeting?
I love Phoenix. I'm actually in Phoenix right now.
Oh, that's right.
So I'm at Implant Pathway out here, and it's in Phoenix, and so I'm out here quite a bit. Phoenix is great. Right now, it's a bit hot, but
Yes.
in at the meeting time, it'll be
No
much more
beverage.
palatable weather.
perfect time for weather. So we're going to have some social events, some of them outdoors. The Academy's pretty good at putting together our social events so people can network. They say that's one of the most important things, or one of the benefits of the AAID is our social networking. And sometimes you learn a lot more behind the stage or in the hallways than they say than at the main podium. But I know people who will come to your main podium will definitely get their money's worth. And the workshops are a definite way for doctors to get more hands-on experience. So I want to thank you for coming out to the meeting. Any last words you want to say before we end our interview here?
Yeah, the AID is always one of my favorite meetings. Content's always great. It's very practical. You don't get a lot of esoteric stuff you're never going to use. So, it's a meeting you can go to and then start using the information in your practice right away. So I've always really enjoyed the content you guys put together at these meetings, and they're always fun. They're a good time, like you said, a lot of good social events. And I've always enjoyed these meetings, and they're in good locations. It's always one of my favorite ones to go to.
Super. Well, Dan, I want to thank you on behalf of the American Academy of Implant Dentistry, Dr. Matt Young, our president this year, and also Dr. Brian Jackson, co-chairman of the meeting with me. So thank you so much. You have a great evening. Get back to work teaching those residents that you're working with. And I look forward to seeing you in Phoenix in November. Thanks so much, Dan.
All right, John, thanks. Look forward to seeing you soon.
My pleasure.